We have seen it time and time again with teens in school and absolute tragedy. And the one question that we as viewers always ask ourselves is, how did this go overlooked? How did it go overlooked that this teen was experiencing as much distress as they were? How did their parents overlook it? How did students or teachers overlook it? And the truth is, it can be very difficult to know what is normal teen behavior and growing pains and what is actually something to be concerned about. And in this episode, I am very excited to share with you an interview that I did with doctor and psychologist Jessica Rabon, who specializes in working with teens, adolescents, and teen mental health. I am your host, Caitlin Gilner, and I'm a master's of social work grad student and a soon-to-be therapist, and I talk about everything mental health and trauma. If you're interested in hearing more about this, you're going to leave this episode with actual tangible resources to go ahead and start steps in supporting your teen who you suspect may be having mental health concerns or depression or anxiety, and also different types of treatment and healing modalities for your teen that might be the best fit for them, because therapy and support is not a one shoe fits all. And let's be honest, it's really difficult to have these conversations with your teen in the first place. So we're going to talk about how to have those conversations, how to trust your gut, and why it's so important to do so. But we're also going to have it to where when you leave this episode, you're going to at least have a little bit of a grasp on what to do next. Thank you so much. Don't forget to like and subscribe. I am so excited, and I hope that you enjoy this next episode. What are
Mhm.
some resources for parents who are looking for services for their child, whether it be therapy or maybe there's some other alternative options? I know that there's like experiential therapy. What,
Mhm.
where can they begin looking for all of this?
Yeah, so there's a number of different, online directories. I mean, Psychology Today is one that a lot of people use for more sliding scale therapy. Oh gosh, I'm blanking on it right now. That will come to me in a second. You can always, if you have insurance, you can look at your insurance company, but honestly, Google too, Googling therapy for teens. If your teen is more, maybe resistant to individual therapy, you can look up support groups in the area. So NAMI, there's NAMI chapters, so the National Alliance of Mental Illness, all over the United States. So you can look up a NAMI chapter, or Mental Health America is another great nonprofit that have support groups or resources, not only support groups for the teen going through whatever they're going through, but also a lot of times for parents. And a lot of these organizations will also have online support groups. So maybe there's not a chapter in your area, but you could still connect with people as well. A lot of times too, I've seen for young boys specifically, really creative ways to get therapeutic intervention, but it's over video games. So I've had a few clients do therapeutic D&D or yeah,
That's so interesting.
yeah, or therapeutic video gaming, whatever, where you're playing video games, but you also are talking about
Oh my God.
whatever you're
Brilliant.
going through. So, I mean, with those types of things, you can just Google in your area, therapeutic D&D for teens. I remember the resource Open Path Collective if you wanted to do a sliding scale fee. But yeah, there's definitely ways that you can get your teen connected that doesn't have to be the traditional one-on-one therapy, sitting on a couch talking to someone, if they would be more open to other avenues as well.
Are you seeing teens go more for telehealth therapy or in person?
It depends on the teen.
Okay.
So I will say my teens that maybe don't drive yet or have a free block at school and, want some independence but can't get to my office will do telehealth. Definitely saw obviously during the pandemic, I was doing primarily telehealth. And then in the year or two after, a lot of teens stuck with telehealth. But in the past couple years, I've seen more wanting to come in person. But honestly, a lot do a hybrid because they'll be like, oh, okay, yeah, I can come this day, but this day we have this. Let me just do telehealth so I don't have to miss my therapy appointment. I can fit it in. I've had teens do it during their free periods, or say they're seniors and they get out of school early. They'll do it once they get out of school, or if they live far away, they tend to prefer telehealth. I think it really depends, but I do think there's a convenience factor that a lot of teens do like because they can just log in from their phone.
Sure. Yeah. I can that would I mean I just assumed that teens would want to do things over telehealth, but I've been hearing different things that oftentimes
Mhm,
they do like to go do it in person, which is great.
mhm.
So really, if I'm just thinking about like working with teens and different healing modalities, what what types of healing methods are you using to work with teens?
Yeah. So I definitely take a eclectic approach. When it comes to depression specifically, I usually start with behavioral activation. So for people that may be unfamiliar, really identifying inherently rewarding or pleasant behaviors and creating a schedule, having them do those behaviors. Because if you recall earlier, I said one of the signs is that they're no longer doing the things they used to enjoy. One thing I didn't mention that is a pretty common sign in teens, particularly of depression, is decrease in hygiene. So they're not showering as much. They might not be brushing their teeth. Their room is a mess. Their clothes are dirty. And so when it comes to like behavioral activation, it's like getting them to do the things that make them feel good. So at the most basic level, we can start with hygiene. But if they're doing those types of things, is it going for a walk? Is it socializing? Is it doing art because you used to really enjoy that? Is it writing or journaling? So identifying things that they used to enjoy and start doing those things. And the reason I usually start with that, it's tangible, it's easy, it's kind of low hanging fruit from the standpoint of like, I'm not having to do all this like cognitive work. Yeah. Okay. You want me to go walk 3 times a week? I used to love walking. Sure. I'll go do that. And then they're like, actually, I feel a lot better when I'm out in the sunshine and walking. I was trained cognitive behavioral therapy. I use a lot of ACTO. I do a lot of values work with teens because I think a lot of times teens either know what they want, but they don't know how to achieve it or feel kind of lost on how can I feel better? Or like my goals just seem out of reach. So I love doing values work with teens, really identifying like what is really important to you? How can we help you live a life that aligns with those things, especially if we're thinking from a developmental perspective. This is the time they're maybe moving away from their parents' values and trying to figure out who they are. I use DBT skills as well. And I also do a lot of somatic work when symptoms present from a physical standpoint. Like mentioned earlier, I see a lot of like stomach pain, headaches, but also just like if we're thinking anxiety, like chest pain, increased heart rate, nausea, things like that. So teaching teens skills to help regulate their nervous system, instill that rest and digest instead of fight or flight response.
What would you say for teens who are maybe more on the behavioral side? Like maybe they're acting out, maybe they're not going to
Mhm,
school, maybe they are getting more angry and aggressive and maybe it's a little bit more serious than just
mhm,
feeling depressed or feeling pressure from their peers or from teachers for schoolwork. What about then? How does
mhm.
that differ? Maybe
Yeah.
all of
No, I think that's a great question because I think when you see more like acting out behavior, whether that's fighting, verbally aggressive, getting kicked out of school, engaging in like substance use or things like that, that's when parents probably feel more helpless or hopeless because they're like, I only have a few more years with my teen before they become an adult. I will say, which teens hate, usually that requires a lot more boundary setting and parental involvement from the parents or guardians from a safety perspective. Like, you obviously don't want your teens sneaking out at night and getting involved with people that are not good influences, or you don't want them fighting at school because they will get suspended. So, working with parents on boundary setting, working with a teen that these are not a punishment. I understand it feels like that, but these are things to keep you safe. And then really working with teen of what is the root cause of this? Like, what is causing you to skip class or, you know, start fights at school? What is causing you to seek out substances to cope? And once you can really like peel back the layers and figure out the cause, then you can make a path forward of like what are more adaptive outlets or coping skills. One thing I recommend a lot to my teens that like express a lot of anger is, can we get a punching bag at home? Like, that is a healthy way to get out your anger. You're not hurting yourself, you're not hurting other people. Do you have a safe place that you can just scream at the top of your lungs when you're really angry? Could you punch a pillow if a punching bag is not available? And also, a lot of times, like, are there things that the school can be doing to help? So, a lot of times I will have to communicate with the school. Is there a certain teacher that is causing this student issue? Are there other students that are causing the individual issues? Is there a learning disability that has gone undiagnosed? But I think, a lot of times we see behavior problems and we want to like label the kid or teen as bad. But I always tell people that the outward expression of behaviors are a reflection of something else that's going on, especially once again, if this is a change in behavior. So, really working with both the parents and the teen on figuring out what is the root cause, setting those boundaries, reinforcing it's not a punishment, it's for safety. And once you start acting in a more healthy manner, the restrictions are going to be lifted. But we have to build that trust and keep you safe for the time being.
Yeah. It sounds like also just streamlining the communication as well, right? Because if you're working with the child and therapy and then it's not being implemented at home with the family, or then maybe it is with the family, but then not the school where they spend majority
Hmm.
of the time. So it sounds like there's a lot of moving parts there as well.
Mhm. Absolutely, and, like, a lot of times, I'll tell people when they come to my office, like, my primary modality is not family therapy. I am not a family therapist. I mean, I did, like, 1 course in family therapy, throughout graduate school and then internship, but, like, I am always happy to, like, supplement family therapy. So if, like, we're working together, but there's a lot of conflict and that's getting in the way of any progress, sure. Bring in the family, let's make sure we're on the same page. If I think family therapy is gonna need to be a primary modality, I encourage families to get a family therapist, and then I will work going back to the communication, work with that therapist as well of, I'm individually working with a teen, you're working with the family system, hopefully the parents are also in their own family or own therapy, how can we all work together? Because I do think communication is so important for really any child, but especially teenagers when they do have a lot more independence than, say, like a 6-year-old. It's a lot easier for the parents to talk to the first grade teacher than the parents to talk to the 4 to 8, depending on how your teen's schedule is, teachers as to what is going on.
Yeah. Yeah, absolutely.